the drivers that drive the kinds of mental health issues we have: income insecurity, food insecurity, housing insecurity, hopelessness, wealth inequality. It was out there before, but of course has been amplified in this moment. And trying to figure out how to both to deal with that and how to make sure that folks have the resources for it is really the big part of what we're here for tonight. I take so much inspiration from how many folks in the community have stood up and lent a shoulder to people who needed one in these moments. But at the same time, there's a lot of shoulders that need some help. The need to care for loved ones, the need, all of a sudden childcare not there, and so people are at home a little bit more often. If you're fortunate, as my wife said to us after we'd been home for a couple of weeks, it turns out we still like each other, which was nice to hear. But we're fortunate, and there are definitely family situations where that's a little bit tougher, and frankly, I think it makes all of us a little bit nervous because we are simultaneously aware that the stresses are going up on folks, but sometimes the reporting signals we have aren't. The kids aren't in school anymore, so you don't necessarily have the teacher marking people's card that it looks like there's a home situation. Domestic violence reporting really collapsed, and I don't think that's because domestic violence went down. It's because all of a sudden people are saying, I don't have childcare. What happens if we have to separate? If someone gets arrested, do I want to put him in a jail where there might be a COVID outbreak? And of course, along with that, we see alcohol sales going up. So we're trying to stay hypersensitive to it. We have, in the course of the various funding bills we've done related to COVID in the House, we've included significant increases in funding for homelessness assistance, suicide prevention, substance abuse, and mental health services. It's not enough. We have more in the various packages that we're still waiting in the Senate to go through, but we will keep pushing. We are, I think we're all very fortunate here to have a really terrific set of panelists here who I look forward to learning from, and as much to learn about what the needs are that we should be watching for legislatively, but even more so to understand, for the folks who are watching, help you understand where the resources are in the community. If you're struggling with some of these issues, if you've got a loved one you're caring for who needs help. So our panelists tonight are going to be Tara Powell, Associate Professor, the School of Social Work at University of Illinois; Scott Block, the Executive Director of the McHenry County Mental Health Board; Enrica McCoy, Associate Professor at the Jane Addams College of Social Work at University of Illinois, Chicago; and Sarah Stoy, a registered nurse at Amita Health in Arlington Heights. So with that by way of introduction, let me turn it over to the legit experts. And we'll start with you, Tara.
Oh, great. Thank you so much, Representative Casson. And it's wonderful to be here tonight. I do have a PowerPoint because I do find that a little bit easier to talk from. So I'm going to go ahead and try to share my PowerPoint. Great. All right. I hope everybody can see that. So yeah, so again, thank you so much. Mental health is just such an important topic right now. My background is in disaster response and recovery, and I've been working in this field for about 15 years since I started working in post-Katrina New Orleans as a new social worker. And one thing that I realized is, a lot of times we don't always recognize how we're experiencing a significant trauma or collective trauma. And a lot of times people don't exactly know where to get help. So a lot of the work that I've been doing over the past 15 years is both helping children recover from disasters and then also helping care providers and parents and teachers and other kinds of social workers and healthcare professionals recognize self-care and how do they recover from these very significant events. So as Representative Caston said, there's so many issues that are going on with COVID-19. I've talked with many people. I've been doing lots of webinars over the past few months, and there's just so many stressors. Stress is normal. We all experience it. But those day-to-day stressors have really amplified. So social isolation, we're all very social people. So, you know, that's increased. We're not used to that. Job security for many, stress around resources, as was mentioned, childcare, becoming home, homeschooling the children. Also, those relationships at home, they can grow or they can become strained. Then there's the unknown, so not knowing what's going to happen. Things are changing every day. And that's one of the biggest things that I found in disasters is not knowing can cause a significant amount of stress, fear. And then also, in addition to COVID, there's, all of the stuff going on at the community and national level. And then finally, separation from loved ones. So we all know this. So I want to talk a little bit about the disaster response cycles. And then also I want to talk a little bit about self-care and also how you can support your children. So as I said, I come from a disaster mental health background. And so what you'll see here is this is just the typical disaster response cycle. So you see there's emotional lows at the bottom, you see there's emotional highs, and generally as people and communities, we kind of fall in the middle. And so before a disaster, we're kind of in the middle. We go up and down a little bit, but then the impact phase happens and really brings our emotions down. But then when communities are coming together, they're going through that heroic and honeymoon phase. And so they're really trying to work together to recover during the disaster. But then as the recovery takes a long time, people get disillusioned, they get exhausted. But then after that, there's this reconstruction phase. And as you'll see here, it says a new beginning. So this is normally what happens in a disaster, in a natural disaster. So we are in very uncharted waters here. So one thing that you'll see is how this looks in COVID is so different. We were all about in the middle pre-COVID. Then there's the threat. Then it got really stressful, emotional, had some more emotional lows. And then communities began bonding together, which is wonderful. And I've seen that throughout, which is great. And that's why I put communities bond together over towards the middle because it's ongoing. But then also within this cycle, you'll see that this is longer term than a natural disaster. This is ongoing. There's a lot of things going on. There's a lot of within our community, within our nation, within families, within everything. Cases continue to rise. There's quarantine fatigue. So different people relate differently to quarantine fatigue. There's the disillusionment phase. Then, we also have the protests at the national level, which can, and community level, which can also cause a lot of stress. And so then I added in here anger, uncertainty, fear. But the one thing that I want to really focus on is that we're still in the middle of this. And in the end, we are actually going to be much more resilient than we were even before. And that's one thing that we know about disasters and collective trauma is that if we work together and build and learn from each other, we'll really be able to bond and overcome this. So while we're still in the middle of this, it's kind of how it looks right now. So one thing that people always ask me when I talk to them is, I've got all these different stressors. Is my response normal? And so the big answer to that is yes. We all react in different ways. Some people will experience more stress. Some people will experience less stress. Every way that we react is, there's no prescribed way that you are supposed to respond to a collective trauma. Some days will be better, some days might be worse, and that's okay. And that's something in all of the work that I talk with, or all the people I talk to, and this comes up disaster after disaster, and it's very similar in the pandemic, is we're all experiencing all these different emotions. So just in terms of thinking, how do we cope? And I've got a lot more information about this, but I'm doing this in a brief timeline. So just thinking about thinking about how we cope, there are so many things we can do. At the individual level, normalizing the stress, recognizing, yeah, I'm stressed out and this is okay and this is normal. And maybe my body's reacting in a certain way. Maybe my mind's reacting in a certain way. Then there's mindfulness. So becoming more just aware of your surroundings in the day to day. Self-care, so important to have a self-care routine. And there are so many resources out there about self-care these days, which is great. It's a very big difference than what I saw, during Hurricane Katrina. We didn't focus on mental health as much. And that's this big change that I've seen. And I think it's so wonderful that we're focusing more on it. Then also giving yourself a break. And that's where self-compassion comes in. So, you know, not expecting too much from yourself and recognizing it's okay. I don't have to um, overexert myself. I have to be compassionate with how I feel. I have to recognize that and be okay with it. And then at this community level, there's these shared experiences. We can learning from each other. So within disasters, you know, especially in collective traumas, there's these shared experiences that you can really talk about with people and learn from each other. Learn good coping strategies, learn all sorts of new you know potential skills. Just talking with people, connecting, and then being compassionate and supporting people that are in need. Recognizing when somebody's experiencing distress and being able to support them. And then also, having compassion for others in addition to your own self-compassion. So I do want to talk a little bit. A lot of my work has been around working with children who have experienced a natural disaster or war, and now, I'm working a lot within COVID and within the pandemic. So there are some factors, some research from the research that we know that really can influence the way a child reacts. But we also do know that most children who experience a collective trauma will be okay. They might have some adverse reactions, but in the long term, they'll recover and actually that they'll gain resilience. And so there's a few factors. So level of impact of the disaster, previous trauma exposure, being separated from caregivers, age, available resources, temperament, gender. These are all things that can affect a child just in the way they react. But then if we look at the lens of trauma, what we realize is most people have went through adverse events in their life and had traumatic life experiences. But if we can build on those protective factors and the strength and resilience on people, and this goes for children as well as adults, we can really help individuals overcome these significant collective traumas and stressors. So there's lots of strategies out there to be able to support children. And there's so many things that you can do. So staying connected with adults. I know this has been out here quite a bit, but setting routines, reducing media overexposure. So it's okay to see the media, but sometimes, especially young children, they're very much sponges. And so recognizing when it's on and what they're seeing, connecting them with peers, even if they can't see each other, in person, play, physical activity. And then another thing that is so important is just asking your children, how are you doing? Listening to what they need, asking them if they have questions. And then, of course, always making sure their basic needs are met. So I'm not going to take too much longer, but I'm just going to bring up a couple things that I've been talking about during the pandemic that I've worked with a lot of communities, and these are things that people have really resonated with and wanted to learn more about. So learning how to help individuals in distress, those skills can come in so handy right now. Taking care of yourself, of course, self-care is critical. When you're going back to work, supporting a distressed colleague, you might have a colleague that's distressed, and what are things you can do to support them? coping with grief and bereavement. So many of us have experienced collective and individual and collective grief because it's a change in our life and our world. Helping young people, and then also coping with social isolation. So those are just a lot of topics that have come up that I've been able to work with people and talk to them about, and hopefully help overcome and become more resilient in the future. So that's it. There, I have a bunch of resources that I will share on coping, mindfulness, self-compassion. Yeah. And thank you so much for having me, and I very much appreciate it.
Thank you so much, Tara. Just a reminder, I know that we've got all this good information coming from folks. I should have said this at the start, but for those of you who have questions, we'll have some times at the end of this for a Q&A for any of the panelists. If you've got questions, throw them in the little chat box wherever you see it. I don't know if we're on whatever protocol we're using right now, but throw them in and then we'll start sorting through those. Our next expert is Scott Block, Executive Director of the McHenry County Mental Health Board. Take it away, Scott.
Got it. Thank you, Congressman. First and foremost, just want to thank you again for your leadership and giving this topic a platform to reach a wide audience tonight. So while COVID is obviously posing a significant threat to physical health, it's definitely just as important to highlight the implications it's having on our overall mental health and well-being. So as a behavioral health community, we thank you for that. As the Executive Director of the Mental Health Board, I've been actively representing the 35 plus provider mental health board network as the formal contact on our countywide emergency management and health department COVID response planning teams. So at no other time in my 20 plus years in the field have I heard all these individuals talking about the importance of mental health services, and mental health providers. So I hope that sentiment remains after we move past these challenging times. I'd be remiss if I didn't take the time to thank all those mental health professionals that have been serving on the front lines as essential healthcare workers since the beginning of this pandemic. So a big thank you to all those frontline mental health professionals as well. So where are we in relation to our collective mental health? We know that prior to the COVID-19 pandemic, few issues affected all of our communities quite like mental health and substance use. The extensive prevalence of behavioral health issues has been known as the public health challenge of our time, and that was prior to COVID. And now we know that research would evidence that 1 in 5 individuals will experience a mental health challenge at any point in their life. 1 in 12 will experience a substance abuse challenge. So we know that COVID has exacerbated that. Recently, the Kaiser Family Foundation conducted a poll which found that 50% of adult respondents had said that COVID has impacted their mental health, and 20% of those respondents said it has significantly impacted their mental health. So that just corroborates the universal impact that we're seeing right now. Furthermore, Dr. Powell mentioned trauma quite a bit, and that's another behavioral health challenge that we're expected to see continue. And researchers have warned that this collective experience will inflict a long-lasting trauma and leave millions of residents throughout the country in these kind of experiencing these shared challenges. So these combined stressors, the global nature of the pandemic, the isolation, social distancing, unemployment, pending recession, these things are all taking a toll. It's difficult to know where to begin to address all of the anxiety and the trauma that we're facing in our community. But what we do know is it's more important now than ever to look after our mental health, both for our own benefit and for those around us. So I'll take the next couple minutes and use my time to address the isolation and trauma that we're experiencing, as well as sharing a few of the resources that are available. And I think you'll see that many of my comments will corroborate the comments of Dr. Powell, and you'll see some themes here that will come up most likely within all of the panelist comments. So first, the impact of isolation and anxiety brought on is not only impacting those who have or those who have loved ones who have actually contracted COVID, but it's impacting everyone, as evidenced by those studies. Why is because everyone has experienced at some point throughout this last couple months some fear for personal safety, and then safety of loved ones, increased health anxiety, maybe anxiety around social withdrawal and loneliness, decreased job and financial securities, and even in some areas, overall switches from a general feeling of safety to survival. So with that, if you're feeling stressed, nervous, or a little bit off these days, you're not alone. So as I reflect on these past couple of months, I think many of us entered the spring and summertime, with excitement and, looking forward to what was to come. And for most of us, that's changed drastically. Children's ceremonies, sporting events, all these happenings that we plan to take part in throughout the summer have been canceled. Schools have switched to e-learning. Parents are challenged with job uncertainty and loss. So this is really starting to weigh on many people. Parents are taking on multiple roles in their homes, multitasking, trying to do everything, and it's leaving a lot of people feel overwhelmed, exhausted, and even inadequate in some of these kind of roles. So it's important that for all those parents who are listening tonight and identifying with this, we want to remind you that each day brings a wide range of emotions, and to manage these fluctuations, you definitely want to be kind to yourselves and try to avoid self-judgment. You have to do the best you can and realize that the best you can do is enough. So I do encourage everyone to reach out for support, whether it's to family, friends, coworkers, faith community, mental health professionals, whoever it is that you feel comfortable with, because physical distancing certainly doesn't have to mean that we're socially distant and disconnected from all of our support systems. Again, as we've just heard from Dr. Powell, good self-care is important, and not only for our well-being, but for the well-being of those that we're around and for all of our loved ones. So self-care is something we can't express the importance of enough. If you're a parent, some helpful tips to use with your family are developing those simple routines at home, taking breaks throughout the day, getting outside to get some fresh air, even sitting outside or taking a walk. These routines are very important for our youth and adolescents, and they're also helpful in limiting that feeling of anxiety and uncertainty. As Dr. Powell stated, also anxiety looks different for each of us. It's a natural response. Anxiety doesn't usually lead us to worrying about the positive things. It forces us to look at worst case scenarios and think about those things that we don't want to face. So this is an exceptionally scary time for many people. Some really simple techniques to help combat that are anything from breathing techniques to physical exercise, journaling, fact checking your thoughts. We have to have somebody that we can do that with, somebody that we trust, and then just sharing our thoughts and feelings of anxiety with the others and those people that we trust. So talking and social connection are very important. It's also important to be cognizant of the fact that parents, as parents, we are our children's teachers. So we are modeling to them how we manage stress, how we manage emotions, and even how we view the current situation. So, being a dad myself, having daughters that are 8 and 10, we all know that yelling, engaging in power struggles with our children is pretty common. But I think at this point in time, we have to agree that that's not always helpful, and really take a step back and make sure that we're not heightening or worsening that situation because of our own anxieties and our own emotional challenges. So we need to be realistic with those expectations and focus on doing what we can. There's a crisis, obviously an opportunity in every crisis, and that opportunity right now is to model healthy behaviors for our children, and we have to continue to do that as adults. So our children will be resilient. They will bounce back and learn how to tolerate these feelings of discomfort, and they'll gain confidence from this challenge. And as long as we help shepherd them through this, they'll end up coming out all right on the other side. So I want to shift a little bit for some of the callers that may not be familiar with a few of the universal resources that are out there and available to them, not only in the 6th Congressional District, but throughout Illinois. The main message I want to put out is a message of hope, and that although many of our providers are struggling right now, we've been here, we continue to be here, and we are here to serve, and we are here to help. I've been proud of the Illinois Department of Human Service response when they developed an early response and created the Illinois Call for Calm text line. For those that aren't familiar with that, if you or a loved one are struggling with any type of stress related to COVID and you need emotional support, you can text the word TALK, TALK, to 552020 for English, or you can text the word Hablar for Spanish. And this service is free and available 24 hours a day, 7 days a week. People will seek assistance, they'll remain anonymous, and they will be able to talk with somebody that will help alleviate some of their feelings of anxiety and connect them with local resources within their region. Another resource we have available to us on Monday through Fridays during your normal business hours is the Illinois Warm Line. Illinois Warm Line is also conducted through the Department of Human Services, and it's staffed by wellness support specialists, which are individuals with lived mental health and substance use experience, and they're in recovery, and they're there to act as peer mentors and help people deal with some of their emotions during these tough times. So the Illinois Warm Line can be accessed at 866-359-7953. And then, as supported by research, we do know that in times during national events like this, we've seen in the past that suicide numbers have continued to rise. And I can't say without enough conviction that intervening in somebody that might have suicidal tendencies or symptoms is not going to force them to actually commit the act. If you see a loved one that's withdrawing from social circles or withdrawing from activities that they previously enjoyed, or even talking about suicide, it's a preventable action and you need to intervene. So there are several opportunities to do that. There's a 24-hour, 7-day-a-week national suicide prevention hotline, which can be accessed at 800-273-TALK. And they will have staff that connect you again with local resources. For those residents living here in McHenry County and throughout parts of the 6th Congressional District, we do have a 24-hour, 7-day-a-week crisis line run through Northwestern Medicine, and that number is 800-892-8900. And we also have several mental health boards that support programs throughout the various communities within the 6th Congressional District. So many of those mental health boards are supporting local helplines, local text-to-tip type programs, and even access to different types of treatment. So as we talk about mental health, I will just say that we can't forget to address all the increases we're seeing in alcohol sales and significant increases in the opioid overdose deaths during this national pandemic. We've seen those death numbers skyrocket in Cook County as well as some of our collar counties when comparing fiscal year 20 to 19. And the DHS runs an Illinois helpline for opioids and substances. So if someone needs to access treatment or find resources, the opioid and substance abuse helpline is again 1-833-2-FIND-HELP. And this line is manned with trained professionals that are aware of resources throughout the state of Illinois, and they have the capacity to help get people into treatment and get them the services that they need. So finally, in many of the areas within the congressional district too, I just want to compliment law enforcement. Over the last several years, many of our local police departments have gotten together and created different way out programs where individuals can walk into police departments and ask for help with their mental health or substance abuse challenges. Then those law enforcement professionals are bringing them to the appropriate contact and service providers. So I do encourage all listeners to take a look at their local law enforcement offices and see if they have either a social worker on staff or if they have somebody that's also involved with a way out type of a program. So there are a wealth of resources out there and available, but it's certainly incumbent upon us to access those. So COVID, I will say, has definitely impacted our providers in a way that they've never seen before. But at the same time, we've seen our providers adapt quickly to offer all kinds of different remote-based, telehealth-based services. So This has been a movement in our field for several years, and this could have taken many years for us to get there, but I've seen providers quickly adapt within a matter of weeks and months to be able to maintain contact with their treatment community, with their clients. So it might not be for everyone, and this will be just a specific moment in time, but providers are there and available through various different remote and telehealth platforms. On a positive note, obviously, we've talked a lot of the negative impacts of COVID, but many of my peer treatment community providers have actually reported increased engagement in treatment because the remote access has removed some of those traditional barriers that we see, like stigma. Individuals may not seek treatment because of the stigma related to it, or transportation. Individuals that maybe couldn't get to intensive outpatient treatment for substance use or a psychiatric appointment because they couldn't make transportation work now have the ability to access those services from platforms like Zoom and WebEx and any other HIPAA compliant platforms. So there are some positives coming out this. I think as the behavioral health community moves forward, our challenge will be, how do we maintain the proper balance between telehealth and remote-based services and those services that we've traditionally conducted on site in physical and group type situations. So we'll be adapting. I've been proud to be in the field and proud to see how quickly we've moved to be able to continuously serve. So again, I appreciate the opportunity to be here tonight and share a couple of those resources. And we're staying positive here, and we're finding the opportunity in this crisis. So, Congressman, I appreciate your time and again giving us the platform tonight. Thank you.
Back and forth. Thank you. And once again, if you have questions, I'm told that we're on both WebEx and Facebook Live, so you can either type a comment in the Facebook chat box or hit the Q&A button on WebEx. Now going to turn over to Dr. Henrika McCoy, Associate Professor at the Jane Addams College of Social Work at University of Illinois, Chicago. Dr. McCoy, the floor is yours.
Great, thank you. So I too am going to share a PowerPoint. So I come to this presentation, this work, having been a clinician for many years. I'm originally from Chicago. I went to school elsewhere, but have always returned home. And so I came to be a social worker really with interest in working with diverse communities related to mental health, but ultimately really found, I thought, some missing information and challenges related to mental health in African Americans, which is what led me to go and continue my education and get a PhD. And so my work is really focused on juvenile offenders or system-involved youth who have mental health issues and how those issues precipitate their involvement into the justice system, as well as the violent experiences for our young African American men 18 to 24. And so what I decided to do with this presentation was really include that population within the broader context. So I want to thank Congressman Caston for including me with this, because this is not a topic that I have yet seen quite a bit about, and I think is certainly important for people to learn. So I have a lot kind of packed into this presentation. What I want to do is kind of give people an overview. So I've got here just some headlines that I've seen that I think really set the context for this. The New York Times reported a few days ago, pandemic within a pandemic, coronavirus and police brutality roil Black communities. Another paper, My Nightmare, COVID-19 meets racism meets the killing of a Black person by police. And I believe that this really gives the context for the mental health piece that I'm talking about here related to Blacks. This is just a quick model that I put together that's really kind of structuring what this talk is about. I think that we are now, the time that we're at, we're seeing a lot of definitions coming at us on the news, and I don't think we often know what those definitions are. And so I decided to try to just give a quick overview of what those are, so that perhaps when you're hearing information, you can have a better understanding of what is it that people are talking about and what is it that they're complaining about. So systemic racism, structural violence, and social determinants of health are really the larger context within we're all living. And then within that, we of course all know we're experiencing the COVID-19 pandemic. Fortunately, Scott and Dr. Powell talked about trauma, so I'll touch on that a little bit. This is also about pre-existing mental health issues. And then we also know we're living in this Black Lives Matter, really civil rights movement that's happening. And so for Blacks right now, that middle bar where I've got current reality is where we're all surviving, where we're living. So I'm sure many of you have seen, lists across the internet. What podcast should I look at? What book should I read? What movie should I watch? I want to be anti-racist, et cetera, et cetera. And so I'm just showing here 3 classics that I think are really important, because I think it's important to understand that systemic racism really is a part of this. And I mentioned I wanted to discuss systemic racism, and I wanted to give a definition, because often when people hear the word racist, they're immediately often offended and saying, I'm not a racist. And so I wanted to make clear that racism has a broader definition than that. So racism refers not only to the overt, intentionally discriminatory actions and attitudes, so perhaps what individual people may be demonstrating, but it really is also about deep-seated societal structures that, even without intent to discriminate, systemically constrain some individuals' opportunities and resources on the basis of their race or ethnic group. So people can't access opportunities because of systemic discrimination that exists. And so think about, for many Blacks in this country, for all Blacks in this country, that they are embedded in a system that is not designed to forward, but to inhibit. From that, we move into kind of thinking about structural violence and health inequality. So I've circled the 2 concepts that I want people to think about in terms of how they specifically relate to this. The structural violence exists, and it's a system that exposes very vulnerable people, and in this case, I'm talking about Blacks in America, to physical, socioeconomic, behavioral, and psychosocial risks that ultimately lead to increased morbidity and mortality. We know, and we've heard from the news repeatedly, and it's been long determined in research, that African Americans in this country have increased morbidity and mortality rates for many reasons. And part of those are really health inequalities. It's because of where they live, and those are often defined by racism. We know about redlining, social class, heteronormativity. And so the outcomes that they experience are often because of this structural violence and racism that exists in our country. The social determinants of health is the 3rd context that I provided, and the World Health Organization says it's the conditions in which people are born, grow, live, work, and age. And they are caused by economic, political, and social conditions, including racism, and linked to health inequities, which are avoidable and not due to individual choice. So the basic part of that is, for Black Americans in this country, all these issues are avoidable, and we can do that with social change, with policy change, with systemic change. These are not individual choices. You will hear people say, well, just go to the doctor, make this choice, go see this person. But the system is not necessarily designed to allow for that opportunity to happen. So fortunately, we've heard a lot about COVID-19, not just from me, but of course in the prior presenters, and I'm sure Sarah will talk about the same. But we know we're living in a COVID-19 pandemic. We know that there's a disproportionate impact not only in our state, but throughout the country for Blacks. We know that part of that is because of pre-existing health conditions, such as hypertension, diabetes. We know that there's unequal access to healthcare. And we know because there are often essential workers, such as bus drivers, working in nursing homes, or that there's a loss of employment, that it increases the risk of contracting COVID-19 or increases the risk for a family member. And so the stress of knowing that when you go about your daily life and you have an increased risk, you may be in fact putting your health at risk and your life at risk is stressful. Trauma. So I'm happy also, like the 2 prior presenters mentioned trauma, so I don't have to say that much about it. But I do want to point out that trauma is not as simple as people think. So we heard about collective trauma, but there's also intergenerational, vicarious, and direct. So intergenerational trauma is the acknowledgement that the trauma that someone else in your family has experienced is transmitted to you. So the trauma that my grandmother has experienced was transmitted to my mother, to me, the same for my grandfather, my father to me. So those are historical things that impact how you live in the world. Vicarious trauma is something as social workers we often realize and we're taught about, but right now all of us are experiencing vicarious trauma. We're all experiencing trauma by seeing on the news repeatedly the murders of Ahmaud Arbery, the murder of George Floyd, the hearing the 911 call of Breonna Taylor. We are being traumatized that although we weren't there, we are having to repeatedly see it. And so it's important to recognize that and to think about that. And so if you're Black, what that means to you, if you think about how that could be you. And direct trauma is what we're more often familiar with when we think about the possibility of being threatened with assault, being physically assaulted. Other examples of trauma can be seeing someone badly hurt, or seeing someone killed, or being threatened with a weapon. And then the Black Lives Matter movement, which we know has been everywhere. We know that Blacks disproportionately die because of police shootings. So although we make up only 13% of the population, the rate of deaths for Blacks by the police is 30 per million, which has resulted in 1,252 deaths in the last 5.5 years, which, although the number of deaths is not higher, certainly the rate of deaths is higher. And so the impact of that on the mental health if you're Black can be pretty significant. And so how does this all come together? This comes together because of why we're here, which is to talk about mental health. So pre-COVID-19, and I named this presentation pre and post because it's important to know that although COVID-19 has impacted Blacks in many ways, there were issues beforehand that are important that aren't going away. And then post-COVID-19, many of those issues will still be there, but exacerbated. So pre-COVID-19, we know that there was already little access to treatment. We know that particularly for African-American males, that if they were presenting in any way that was angry or hostile, they were often perceived as violent and not given mental health services despite need. We know for African-American youth that they are often misdiagnosed or not diagnosed, and that can be related to poor screening, that can be related to not being able to really ascertain what the issues are. We also know that African-American youth are much more likely to be referred to the correctional system as opposed to psychiatric services. And ultimately, this increases the contact that they have with the criminal justice system. So in essence, we're criminalizing mental health issues. I have this here, Dr. David R. Williams, who's a professor at Harvard. He's the world's foremost expert on the impact of racism and discrimination on health outcomes. And yesterday on MSNBC, he made this statement related to a research study that he and his team conducted. Every police shooting of an unarmed African American leads to worse mental health for the entire Black population in the state for which it occurred for the next 3 months. So think about the impact of that. We are, as I mentioned earlier, repeatedly seeing the deaths of Ahmaud Arbery and George Floyd on TV. And now we're seeing new videotapes of new people that have been murdered that we didn't know about, we assume, but now we have video evidence that are showing up on our TVs constantly. So the state of repetitive trauma that's occurring, we are having to witness every day. So this leaves us kind of at the end. What does that mean? We already know, right, that there's racism, discrimination, there's poverty, there's violence that we experience. All those things really are reflected in kind of this word cloud. Imagine that we're in the middle of that cloud and all of these feelings are surrounding us, that we're expected to kind of act normal, to move forward. But how hard that must be. When you had pre-existing issues, you are now living in a pandemic, and we thought that was bad enough. You already had trauma, perhaps. Now we're in what should be, hopefully, a wonderful movement towards acknowledging that Black lives do matter, that there is a need to eliminate racism. But in the midst of all, there's still mental health issues. And so I want to make sure that people understand it's important that all of this still requires for people to continue to seek the mental health services that they were getting, if they were getting them. If they weren't, that it's okay to now seek mental health services. It's okay to take care of yourself. That came up both with Scott and Dr. Powell. Self-care is important. It's important because in order to move forward into progress, you have to put yourself first and take care of yourself. And to recognize that their symptoms may have ups and downs every day, that there's a myriad of symptoms, and that's okay, but that it certainly should be expected. There's a huge stigma that often exists in the African American community related to getting mental health services, mental health treatment. There's often, it's the belief is that our people survived slavery, take it to the church, you should keep your feelings private. But the fact is that these are extraordinary times, and these are all issues that we can't control. And so we have to be able to empower ourselves to seek support and help. And we have to really advocate for change so that there is increased access to mental health services and there's increased access to policy changes that allow those larger pre-existing conditions and structural racism, structural violence, the determinants of health to really be eliminated. So thank you very much.
Thank you, Dr. McCoy. Really powerful stuff. Our last speaker today, before we open up for questions, is Sarah Stoy, registered nurse at Amita Health. And Sarah, the floor is yours.
Hi. Hi, and thank you so much, Representative Caston, for inviting me to participate. I really appreciate this opportunity, and I've learned a lot from the other panelists, and I think some of the things that I am going to say will be a little bit repetitive, maybe hitting some, touching on some points that are meant to be heard more than once. Let me just see if I can go ahead and share my screen here. Okay. Do that. Okay, I'm hoping that you can see this. So yeah, so I'm just wanted to touch on some things that have already been mentioned, but one of the things that I found very interesting was the mention of stigma and mental health and coronavirus, because I think typically stigma, at least for me in the past, I was thinking of it as something that was external, you know, something that was external towards others. And what I'm hearing also is a point that I wanted to make, which is there's this internal stigma too, the way that we look at ourselves, the way that we perceive ourselves, and that too is a barrier, which we've heard from our other panelists. That's a barrier to first self-identification of what is going on inside my own self and what I might need help with. So the CDC talked about stigma. I read this recently. It is particularly common in disease outbreaks, and a very simple definition of that is that it's an unfounded or assumed association between a risk and a person or group of people, a place, or a thing. So simply put, I could say if you are A, then you are also B. That's an assumption. I made an assumption. And I think that when put that simply, I think people probably, examples can come to mind for themselves. I think stigma is fed by fear, and we've heard that. Fear. There's been a lot of fear lately. And I think fear feeds the anxiety and panic that a lot of people have been feeling, and that I myself felt at the beginning of the coronavirus pandemic, and that I've also seen in working with clients of the Community Mental Health Center in Arlington Heights. Then, of course, coronavirus. This was also mentioned. It's scary. It's something we can't see. It's something we don't know a lot about. There's a lot of uncertainty changing how we live, how we work, how we play. It's going to continue to do that. It's not something that's just going to go away. We have to adjust. We have to adapt. One thing that I noticed based on all of the coverage, the news reports, commentary, is that this pandemic and the other current events that have been happening, it's revealing this full range of humanity's character. So what I mean by that is we're seeing in ourselves, in our communities, in our government, the best from the best to the worst behaviors, perceptions, and attitudes towards ourselves and each other. It's a very critical time to kind of take advantage of that, and this is one of those things like what we're doing right now. We're using this for a good purpose and hopefully for change to come. Treatment. So all of the other panelists touched on this as well, and some of the things that they've been doing. Here at the Community Mental Health Center, what I've noticed is we had to adapt fast. And I know Scott talked about that too. We had to go from all of our in-person outpatient mental health services and figure out how we were going to move all of those to online so that we could protect staff and we could protect clients from coronavirus. In addition to that, though, we were putting people at risk who were already experiencing problems at home, domestic violence. This was touched on. That is an issue. And we had to move to protected online services. At the same time, we're constantly learning to modify and continue these services and try to figure out how we're going to transition to when we stop sheltering in place. And now that we're not sheltering in place, we're trying to figure out how to phase in on site and yet still protect some of the more vulnerable people. Like the protection goes both ways. We want the people who are experiencing in-home domestic violence and other issues to be able to come on site. We want those people to get that safety and to get that care that they need, but we also want to keep other people who are immunocompromised we want to give them that opportunity to still be covered by insurance and maybe have online services continue for a little while longer. One thing that we have found, and I think Scott mentioned this too, client engagement and success, that we've had a lot of that with our telehealth services. We've had a lot of positive client reviews of the services that we've provided. We have had other people who don't like it and they cannot wait to get back on site. So I think it goes both ways. We are now talking about how we're going to reopen. We're going to reopen in stages. Scott mentioned what that might look like. We're preparing for future too, so blended hybrid formats maybe in some of our programs, such as the group partial hospitalization programs. How do we maybe provide that on-site setting as well as offer it at the same time at home to some people who maybe are immunocompromised and don't want to yet come back to the physical space. So, but we're also preparing for that in that way in case there is another uptick, or maybe in the winter if coronavirus, the rates increase again, how are we going to manage that? And we follow the CDC, so we'll go with what they say, and hopefully, we'll be ready because we've done it now. Insurance coverage, a big thing, as other people touched on as well. And the whole reason we were able to move all of our services over is because the insurance companies were pretty much mandated to cover those services, which I, in full appreciation of, we've been able to continue all of our services and help people through this time period. So these have been mentioned by people too. Scott mentioned some of these. These are a lot of the services that are available to people. I'm not going to go through each one. One thing I wanted to point out is partial hospitalization is often thought of as like an addiction recovery or recovery from alcoholism, but it is also a type of program that is offered to people who are struggling with mental health issues. So it does not necessarily cover addiction. So we have these services for people who are severely depressed and can't get out of bed. We have a place for them to come and they learn how to recover. They get the care they need, they stabilize, and then they can slowly move on and move out and back into the community in their daily lives. So these are all the programs, but if anybody has questions, my contact information is at the end of the slide. So what can you do? And these are some of the things that have been mentioned, and I appreciate the mindfulness and the breathe and slow down, because there is actually science behind slow breathing. I mean, it's not just a woo-woo thing that some people think of mindfulness. It actually physiologically slows down your nervous system. It is something that anybody can do at any time, and it is something that helps us lower that level of anxiety, that panic, that inability to critically think about what is going on outside of ourselves and inside of ourselves. And it allows us, again, to reflect on our own internal barriers to taking action. And I think, yes, there are so many different ways that we are impacted, but we have to start with where we are. We have to start with the individual and then start asking questions. What do I need and what can I do? And the self-care, important. If you're not caring for yourself or you can't care for yourself, it's more difficult to help others. So it's important to think about, where am I at? What do I need? And to ask questions. There's no harm in asking questions. So yeah, my suggestions: call your community mental health center, do an online search. It comes right up. Call your insurance company if you have insurance. If you don't have insurance, we have case management services, for instance, where our case managers do help people figure out how to get state or federal plans. And just know it's okay to advocate for yourself. It's okay to say, I need this, or I need help, or I don't know what I need, but I'm going to make some calls and ask some questions. Or if it's somebody you love who is not able to do that, it's okay to start asking questions for them. These are resources. Some of these were mentioned by Scott. The talk, the OBLAR with the 552-020. And I have another list. Many community health, mental health centers, they're available regardless of, the services are available regardless of where you live. So it's easy to do an online search or call these numbers. And then I have also another spreadsheet that we keep on hand to our intake line. Many of these were mentioned by Scott. There's also a senior helpline, homeless hotline. So there's a lot of hotlines and places that you can call to get help. And you can also remain anonymous if that's something that you're worried about initially, which I know some people are. So yeah, that was it. That was super quick, but I hope you got something out of it. And I thank you so much for allowing me to be a part of this. I really appreciate it.
Thank you, Sarah. Thanks so much to all the speakers. Really appreciate not just you taking the time tonight, but all the work you do to help out the folks who need your services. We're going to open up for questions now with the time we have left. I think someone on our end, I think it's Laura, is going to go through. But if you have questions, if you haven't put them in the Q&A block on WebEx, throw them in Facebook. General questions for any of us, including me, throw it in. And Laura, you are now the moderator. So we play a, what do they call it on Car Talk? Stump the Chumps.
Thank you, Congressman. I'm going to direct this first question to Dr. Powell first, and then anybody else would like to jump in. April posted in WebEx, what will the impact be on youth if schools do not reopen in August, specifically for teenagers who might be struggling with depression caused by this crisis?
Yes, that's a very good question. And it's definitely, it's a bit hard to know exactly what the impact will be on them. But if you can get them to some kind of sense of new normal, then that can be very helpful. Getting them in some kind of other routine. They have lots of expectations. When you're a teenager, your brain is growing as fast as when you were a little, an infant, a small child. And so, there's a lot of emotions that will come up. So, helping them realize a new routine they can have. If they need mental health support, getting them in to talk to somebody, a sense of purpose. Even if they can't go to their job, having some kind of sense of purpose or altruism. There are so many little things that we can do for our teens to be able to support them, but also recognizing, yeah, this is hard and it's okay to be upset. But listening to what their needs are and trying to direct them in ways that they can really start expressing themselves or get the support they need, I guess, is really critical.
Okay, thank you. This question is for Representative Caston. Andrew on Facebook is asking about the CARES Act. In the CARES Act, behavioral health received $425 million, or roughly 1/5 of 1% of all public health dollars in the bill. How can we increase this amount in future bills?
So it's funny that that bill was so enormously big that these huge numbers seem small in terms of percentages. You're right, though, that the CARES Act had a whole lot of things that were not specifically mentally health related. The HEROES Act, which we have subsequently passed in the House, and of course are trying to encourage our friends in the Senate to take it up, does substantially expand most of those programs. So, for example, I think the CARES Act had something in the neighborhood of $425 million for substance abuse and mental health services. There's an additional $1.5 billion for that in the HEROES Act. The CARES Act had, I think, about $250 million for community behavioral health clinics. There's $1 billion for community mental health block grants, and I could go on through, but there's absolutely a recognition that those programs were the beginnings, but needs to be more that's there also. There also are a lot of things that are frankly not directly financial and are both state and federal, and some of the speakers alluded to this. Making sure that hospitals can provide telehealth services and that they can be compensated for them by insurance providers, because historically certain types of medical care have not been reimbursable through telehealth. So changes made at both the state and the federal level to make sure that that's reimbursable. I think, and I don't want to speak for the healthcare professionals on the phone, but I've just heard just fantastic feedback on that as far as making sure that people who need care can get it, and also that healthcare professionals aren't sitting there saying, well, I'd love to do this, it seems good, but I also have a family to feed. So the answer is yes, we continue to expand and we continue to watch to see where the need is, and that's why we're having calls like this.
Thank you. This is a multi-part question that I'll direct to Dr. McCoy to begin with. Anyone else who wants to weigh in, please feel free to do so. Susanna on Facebook says that we need police reforms and suggests that an independent citizens review board might be helpful. But we don't have time to get into all the details of what reforms might be appropriate. Can you just comment on how police reforms could have a positive impact on mental health? And to what extent will police reforms help people handle the stressful effects of racism? And how might we divert resources from the police to mental health professionals who might be better able to respond to mental health emergencies?
Well, that's a heavy question. I think it's an important question, and I think there are so many answers to that. I'm certainly a believer in police reform. I think, there are social workers at police stations. People often don't know that. They are there. There are not enough of them, and that's certainly one place that funds can be diverted. There are also funds for CIT training, which is crisis intervention training, which is for police officers to have a better understanding of how to engage with people who have serious mental illness, so that we don't have incidents like we've had before where people with mental illness are, their interactions are misinterpreted and they're killed. But I think, a significant piece of it has to be, it's not just about the mental health piece, it's about the stereotypes that we live with every day in our society that creates the perception that if you're Black, and particularly Black and male, that you are by default violent and a criminal. And so there's certainly research that shows, and certainly lots of personal narratives that can talk about how a behavior by a person who's Black is completely misinterpreted and would be treated very differently. So part of what we have to do is begin to have police, and let me just say, I am not a person who's a hater of the police. I know many good police. I think the majority are. So let me just start with that. I am not that person who thinks that, every policeman is out there to kill all Black people, et cetera, et cetera. But the fact is, we live in a society that's built on a sin of racism, and we have to deal with that across the board. And if we can't deal with that, we can't deal with how do we deal with mental health issues. Because no matter what happens, if you look at a person and it's built on your perception through the eyes of racism, the problem won't be solved. So our reform has to start with education. It has to start with creating relationships between communities and between police officers. It's very easy to respond assertively, aggressively, negatively, and harmfully if you don't see that person as an individual. I think there's a lot of answers. I'll let other people pipe in here, but I think, yes, we need reform. We need more mental health professionals that are trained in police stations, including social workers in particular. They provide more mental health services than any other professions combined. We have to start with training police about humanity related to people and not just criminals. And we have to have communities understand, and I won't say understand, we have to have communities have the opportunity to be viewed differently. And until that happens, nothing's going to change. I'm just going to give a tiny example from the news earlier today. I live in Chicago, and Mayor Lightfoot was on TV with Congressman Rush talking about the police who were lounging in his office today, or in his office on May 31st and June 1st, when there was civil unrest outside of his office, and nothing was being done. That is not a way to gain the trust of the community. And so if you want the community to be trusting, you also have to do your part. It has to be a meeting of both ends. And unfortunately, because police have power in our society, there probably has to be a little bit more work on their side before the community is going to move forward. So I'll stop there. I'm not sure if I even answered the question, but I'm going to stop there.
Let me chime in just a little bit, because we've been asking these questions at significant length in the Congress over the last couple of weeks as we think about what we're gonna do going forward. And the first thing I just point out is what I said at the start of this session. Before COVID hit, when I'd go around and I'd meet with local sheriffs and police departments, and I'd say, "What's the big issue you're dealing with?" They'd all say mental health, and more often than not, they'd say that I think they largely still do say that the police get called in to solve problems that no one else is solving. That's not necessarily the problems they were trained to solve. And so they end up being called in, and you see these stories of people who've been shot, and oftentimes it's someone who's struggling with schizophrenia or someone who's struggling with a substance abuse problem. And the police aren't trained to solve that. They're going to, they're going to be bringing the wrong tool to the wrong problem. I think in general, and there of course, there are exceptions, but I think in general, the police departments are pretty receptive to the idea of giving them training and tools to solve the problems they have, not forcing them to use the tools they have on the problems that are made manifest. But at the same time, and I'm glad you brought up the civilian review boards, because we had a fascinating briefing with from Loretta Lynch, the former Attorney General, last week. And during her tenure, they were involved in things like the consent decree with Chicago after the Laquan McDonald shooting. And she said that they did a fairly exhaustive review and found that in every case where they made meaningful changes that really stuck in the police department, number one, they had to have a change of senior management within the police department. Number two, they had to have some outside agency that could hold the police force accountable, which was often the Department of Justice. I'm not sure who else that would be, but it doesn't have to be them. And then the third was that they had to have civilian review boards that had transparency and could hold people accountable, had real teeth to them. And her observation was that when they did that, it actually significantly boosted police force morale, because it's easy in this moment. We look at who the victims are and who the abusers are, and you can get pretty down on police. But imagine you're a good cop and you're sitting there wondering whether you want to wear your uniform and you leave the premises because your whole profession has been demeaned. It's stressful to be a good cop in this moment, right? And so we remove the trauma on the good cops by holding the bad cops accountable and setting rules in place that says this is how it's going to get done. But it's not going to be done overnight, and it takes a broad and systemic approach, and that is the intent of the bill that I expect will pass before the end of this month. But we need a cooperative Department of Justice to really make sure it goes through, because the parting words that Attorney General Lynch said to us was that in the current administration there has been a grand total of one consent decree with the U.S. Police Department. And that's not because there's been fewer instances of abuse. The Department of Justice just hasn't seen their role as making sure that local law enforcement meets those standards.
Congressman, if I may, I've done a significant amount of work in this space prior to the Mental Health Board. I worked for the 22nd Circuit and developed from the ground up our mental health courts, drug courts, domestic violence courts, served as the president of the Mental Health Court Association of Illinois and the vice president of our drug court association. So within that experience, I met law enforcement and criminal justice professionals throughout the entire state. And a couple things that we continue to need to have your support for at the federal level are certainly ongoing funding for those tools like drug courts and mental health courts. And I know there's been bipartisan support for those for years, so we appreciate that. And the other thing is training. What we've done here with some local dollars is we have been able to train about 300 law enforcement officers in mental health first aid, which is also an 8-hour training with a public safety and law enforcement component. We did that by training a law enforcement officer as the trainer so that he could go out and provide that training directly to his constituents and his peers. So I think that's an important piece of the puzzle, is that continued training. And then just a plug, later in the year, we're working with Chief Justice Burke and developing a criminal justice and mental health summit that'll be carried out in 5 segments throughout October. So I'll be sure to get you the information that you can promote, and that'll be accessed to historically about 500 treatment and law enforcement criminal justice professionals attend that. So the more training I would say that we can give for our officers, the better off we will be.
Sarah, both you and Dr. Powell spoke about self-care. There are new tech resources for mental health like mindful breathing and meditation apps. Do you recommend these in general, and what about for children?
I'll let Dr. Powell start.
Okay, yeah, great. Yeah, these can be really, really powerful, and they can significantly help people. There's all sorts of different apps, and I highly recommend them. In terms of ones for children, you just have to make sure that it is designed for the specific age group. So, something that works for an adult might not necessarily work for like a 7 or 8-year-old. But there are all sorts of really great resources out there to do mindfulness activities with younger children, and they're fun, and it really resonates with them. So I'm a big advocate of these apps. They can be super helpful. And I think they can really help in terms of relieving some of that anxiety that we have and getting you used to some mindfulness. I'll send it off to you.
Thank you. Yeah, actually, I think we're lucky, right, in this time period to have so many opportunities online for this. I can't really speak for the younger population, but I can say that even some of the apps, like Insight Timer, 10%. Insight Timer recently expanded their section for children, and it's an amazing app. And one of the other things is a lot of the guided meditations and mindfulness practices are offered free. So I think that's super important. Insight Timer is one of the ones I know that they offer the majority of their mindfulness. There's other pieces that you pay for, but you can get pretty far with just the regular part of the Insight Timer. It's amazing, and it's something that I recommend to most people who ask. So that would be one to check out for sure.
Thank you. This will be our final question, and then we can open it up for final comments. I'll direct this towards Scott first, and if anyone else wants to jump in, please feel free. Scott, you particularly mentioned resetting expectations. Brendan is hearing often from his teenagers who have missed out on experiences like prom and graduation that this is not fair. How can we help friends and family with these feelings of helplessness, lack of control, and injustice?
Great question. Dan, those teens are right. It's not fair. So first and foremost, I think we need to go ahead and validate those feelings, because they are growing up and experiencing things that the rest of us did not experience. Whatever that is, negative or positive, it's not fair. So first and foremost, I say it's okay to validate that. But then, taking that a step further, it's important to continue to talk about how this is a particular moment in time. It's certainly a historical moment, and there's lessons that will be learned. There will be some positives that come out of this. So, I tend to try to flip the conversation and focus a little bit on the positive, and a little bit focus on that this is just a moment in time. So I think those would be my, two approaches and two comments in relation to that, and maybe defer to our doctors on the panel that might have some other advice.
So I think that's actually great advice, but I so much agree. I think a few things that we can do with our teens, and these are huge factors in resilience, is yes, normalizing, like, yeah, this isn't fair. This isn't what you were expecting, but also trying to find something where we can give them hope for the future and forward thinking. And you can do that in so many different ways, but to recognize what they're feeling, and then also to try to get that forward thinking, try to look towards the future, try to think of ways that they can have hope, and get a sense of purpose. And those are all things that, just little strategies that you can use to help support them, even though this time really is not too fun when you're when you want to go to prom and graduation, and you're not experiencing that in person.
Thank you so much. Turn this over to Dr. McCoy for her final comments.
Okay. I would just say that I think, I'm appreciative of having been on the panel. I learned a lot, not only just about new issues, but just a reminder of kind of my own work. And I think, we're living, as it was just mentioned, in very difficult, challenging new times. And I think not only is it important for self-care, but we have a great opportunity to make great change in our world right now. I am not by nature a pessimistic person. I think I'm a pretty realistic person, actually. And this is an opportunity. Do I wish we did not have a pandemic? Yes. Do I wish that we were in times that felt more hopeful? Yes. But I think there is an opportunity for hope. I think mental health is an opportunity that being there for someone who's struggling with mental health issues, this is actually an opportunity to do that, because unfortunately for them, it may be on display more often than not at this moment. But that means there's an opportunity for you to make a sorely needed connection, and for you to learn a lot more about those issues and really help them advocate for themselves if they're able, and if not, be a support and work towards advocacy on a larger structural issues. I think we forget as people that we have the power through our vote, through our advocacy, through lobbying, letter writing, calling to make change. And it's important that we do that. And we are facing an election coming up at many levels. We are seeing protests around our country every day around the world. And if you can't be there, that's fine. I will say I'm still quarantining in my house. I'm not going out. I am still fearful of COVID-19. I'm not going anywhere. But that doesn't mean that you can't affect change in some other way. So find out what those opportunities are, find out what your niche area is, and take advantage of it. I'm very thrilled to have been on this panel. I'm impressed with Congressman Caston. I did some homework before being on this panel and saying yes. I looked at videos, etc. And so I think the people in the 6th District are very lucky. And I think you have an opportunity here because you have someone who's out advocating for great change. And so make use of that, ask for what you want and join and support him in doing that work. I think it's that kind of work that's only going to be positive for us going forward. So those are my last comments.
Thank you so much, Dr. McCoy. Sarah, would you like to make a final comment?
Okay, so yeah, thank you so much for having me on this panel. I really enjoyed listening to what the others had to share and offer. And one thing that I'm taking away tonight is, yes, that idea about advocating for, well, being a nurse, advocating for the ones that I care for. When we run into issues caring for people, whether it's through insurance or being able to provide services to somebody, lack of access, it's important. It makes me want to speak out more. It makes me want to take those issues to somebody like Representative Caston and say, okay, hey, what can we do about it, and how do I get more involved? So I appreciate that. That I'm learning a lot tonight. So thank you.
Thank you, Sarah. Scott?
Yes, thank you, Laura. I will speak, to the provider perspective, that without providers, we don't have services. National Council for Behavioral Health polled over 800 community mental health centers throughout the country and found that 65% had already laid off staff and about 80% plan to lay off more. We conducted a similar financial poll of our 35 network providers in McHenry County and found that 80+% have already lost revenues due to canceled fundraising events, reduced philanthropic giving, and reduced volume from their patients and reduced inability to bill because of that volume. So I'm fearful that we're dedicating a lot of money through the CARES Act and the HEROES Act today, but 6 months and a year from now, when our providers aren't able to access the revenues, we're likely to see a real significant impact on their ability and capacity to serve. So we can't, focus all our energies on the here and now, and we do have to have an eye to the future. So thank you.
Thank you, Scott. Dr. Powell?
Yeah, I just like to echo what everybody else has said. I'm so happy that to be on this panel and to hear all of the other experts discuss these such important issues. We've come such a long way, in the past 10 to 15 years in terms of recognizing mental health and reducing some of the stigma, but there's still a long way to go. And then, also with all of the structural, inequalities that we have, we're at a hard time for so many levels, but we're also at a real time of growth. And I think that's something that we can see with the protests, with the reactions to COVID, with everything. We're at a time of growth and learning from each other. And I just, we definitely have to take care of ourselves, but also it's kind of an exciting time to learn and grow from other people and our communities and really bond together. So thank you so much to Congressman Caston, and was very happy to be on the panel.
Thank you,
Dr. Powell.
Thank you, Dr. Powell. Thank you, Dr. McCoy, Scott, Sarah. Thank you to all of you who have been listening in. I'm sitting here reflecting, and shortly after COVID hit, I was reaching out to, when schools were still in session and we didn't know if they were going to be permanently down, and I called all the superintendents in the district to find out how they were doing, what issues we need to be thinking about legislatively, and what they were hearing. And there's this piece of wisdom that stuck with me. One of the superintendents, I said, how are the families doing with all this? And she said, the families of need are doing okay because they learned how to hustle a long time ago. The families of means are in a position where they've lost control and they haven't developed the tools to deal with that, and that's really hard. And it just resonates with me and everything we're talking about today, because as humans we can adjust, but when things change quickly and violate our expectations is when it gets hard in that time of process. And I think, much like Dr. McCoy, I'm an optimist, but I'm a realist. And let's start with the realism. We're still in for a hard slog. We're in this vicious cycle right now, especially if you're a minority, where the stresses of racism made you more prone to hypertension, and then that made you more prone for comorbidities from COVID. And of course, those things all combine to create more economic insecurity, which feeds back into stress at the top of the chain. And I don't care what color your skin is, we're all somewhere in that chain right now and feeling that stress. And we can't break that stress by some unilateral government action. If the governor and the president and your member of Congress said the economy's open tomorrow, but you don't feel safe, you're probably not going to go to a Cubs game. And that uncertainty is just going to linger until we get through this public health crisis. And that takes all of us working together. And, and within that, I think we have, the realism comes from dealing with the world as it is and figuring out how to adapt to it. But the optimism comes from the fact that we all have agency in making this better. We can all provide a shoulder for other people to lean on. I so appreciate what the folks on this call are doing in your own capacity to help people out. But we all also help that out in other ways, right? When you wear a mask, when you go out, when you do your social distancing, when you call up a loved one who's in an elder care facility and can't see somebody but just wants to talk. All those little things help. And thanks for doing it. But once we get through the public health crisis, we still have some of these structural issues that are out there. I'm going to go out on a limb and say that once coronavirus is behind us, we're still going to be grappling with the legacy of our original sin, as Dr. McCoy put it. But that's also an opportunity for us all to work on something bigger than ourselves. Because if we can deal with some of these inequities, and not just racially, if you didn't have health insurance coming into this pandemic, it's a lot more stressful than if you did. If you only had $500 in your bank account, as something like 50% of Americans do, losing your job's a lot more stressful than if you had a little bit of a cushion. And I think we have the opportunity when we come out of this to build, not to go back to where we were before, but to go forward to something greater, and that'll be something that we can all work on together. So, and some of you have heard me say this before, but there's that beautiful line of Martin Luther King's that the arc of history is long, but it bends towards justice. We all jump up and grab it, it'll bend quicker. So let's go bend it together. Thank you all.
Thank you.
Thank you.